Diabetes is a chronic condition that poses multiple dangers to the health of millions worldwide. If poorly managed, it can lead to serious complications such as cardiovascular disease, kidney failure, blindness, neuropathy, amputations in the lower limbs, and reduced quality of life. As per World Health Organization, in 2019, diabetes was the direct cause of 1.5 million deaths, and 48% of all deaths due to diabetes occurred before the age of 70 years. Among the most significant complications of diabetes is arterial stiffness, which increases the risk of developing cardiovascular disease, the leading cause of death in people with diabetes. Arterial stiffness can be detected early by undergoing a non-invasive pulse wave velocity measurement test, which provides valuable information about the state of the arteries and the heart. Pulse wave velocity, PWV, measures the speed of pulse waves through the arteries, providing information about arterial stiffness and cardiovascular disease risk in diabetics. Non-invasive central blood pressure measurement assesses the pressure in the central arteries closer to the heart, offering a more accurate measure of the pressure the heart is working against and a better predictor of cardiovascular disease risk. Similarly, the ankle brachial index, ABI, test can be used to detect peripheral artery disease, PAD, another common complication of diabetes that affects blood vessels in the legs and feet. Early detection of PAD through ABI testing enables timely interventions to prevent complications such as ulcers, gangrene, and amputation, and reduce the risk of cardiovascular disease. Cardiac autonomic neuropathy, CAN, is a common complication of diabetes that affects the nerves controlling the heart and blood vessels, leading to increased mortality rates in people with diabetes. HRV testing is a non-invasive tool used to detect cardiac autonomic neuropathy, CAN, in diabetics. The test monitors heart rate variability and provides early signs of CAN and an increased risk of cardiovascular disease. Ewing's tests, a battery of non-invasive diagnostic tests, are considered a gold standard for the diagnosis of CAN in diabetics. These tests measure heart rate and blood pressure responses to changes in posture and breathing, providing comprehensive evaluation of the cardiovascular system. Identifying CAN early and initiating appropriate treatment can help manage symptoms, prevent further damage, and reduce the risk of cardiovascular complications such as heart attacks, sudden cardiac death, and stroke. Peripheral neuropathy, which affects up to 50% of people with diabetes, is another complication of diabetes that affects nerves outside the brain and spinal cord, such as those in the legs, feet, arms, and hands. The nerve damage caused by peripheral neuropathy can lead to a loss of sensation in the feet and hands, making it difficult to detect injuries or infections. This can lead to the development of foot ulcers, which can become infected and even lead to amputations. Regular screening and prompt management of peripheral neuropathy in people with diabetes is crucial in preventing further damage and complications. The Vibration Perception Threshold (VPT) test is a non-invasive test used to assess peripheral neuropathy. Diabetic patients need to undergo regular spirometry to assess their lung function, as diabetes can lead to respiratory problems. Spirometry measures lung function by assessing airflow, enabling healthcare professionals to identify patients at risk of developing respiratory issues. In summary, the dangers of diabetes go beyond just high blood sugar levels. From cardiovascular disease to peripheral neuropathy, the risks are many. That's why regular screening and early detection are critical in preventing further damage and complications. For the first time, there is a convergence of all these important tests in a single device, the Diabetes Risk Profiler. As demonstrated, all the tests put together measure more than 60 parameters. The clinical information with observed and normal values of all test parameters is displayed and printed in the full disclosure report of 13 pages. As a clinician, you will be able to correlate the results at a glance of all tests with interpretation, clinical recommendations, and therapeutic suggestions, based on respective tests, on a single page, saving you a lot of time, thus saving the patient multiple tests cost and inconvenience. Thanks for watching.